Now, the 2025 FNB App of the Year award went to Vula Medical, a medical referral app developed by Dr William Mapham. And Maphamp had the idea for the app while working at the Vula Emehlo Eye Clinic in rural Eswatini, where he experienced firsthand the difficulties faced by rural health workers when they needed specialist advice. The man behind the app joins us now for a conversation. And William, thank you so much for your time this evening here on SABC News. Firstly, I'd like to say congratulations on your award and your achievement, which you were given by FNB this week.
Thank you very much. It's a great honor and a real tribute to the team behind the scenes, and also just dedicated to the health workers who are all on the front line at the moment. I think they're the real heroes of the day.
And maybe let's talk about more when it comes to the app itself. I mean, you developed this app while you were working in Eswatini. What made you come up with this app?
So I think as a junior doctor, I experienced the pain of referring or trying to get hold of specialist opinions and patients suffering because I couldn't get them in time. And I think if you speak to any doctor, they will speak of the ghosts of patients past, the ones that kind of haunt you, where not the right thing didn't happen at the right time. And at the Vula Medical Eye Clinic, we had a rural healthcare worker who had a phone with that could take a picture, and she sent me the first picture. And I know it sounds so crazy, but back in 2010, this was a whole new thing. And suddenly we realized that we could actually connect rural healthcare workers with specialists. And so we had to build Vula.
And what concerned you most when it came to some of the issues that rural healthcare, workers faced, particularly those who find themselves in very remote areas?
Yeah, so I'm a rural doctor by passion and part of the Rural Doctors Association of South Africa. And we obviously go into rural areas very well meaning. You get as much training as you can. But it is impossible to know everything. And I think the pain that we wanted to take away was access to specialist knowledge. So Vula started off with ophthalmology, which is eye care, and today it's used in more than 76 specialties. So now a rural healthcare worker can access advice from a whole range of specialists, from dermatologists, cardiologists, psychiatrists, and so on. So I think it's really exciting to see how it's grown.
And maybe just, Dr. Mapham, just take us through how it actually works, particularly for those who will be making use of it in rural communities.
Yeah, so if I came to you and you're my GP or my health worker that I've gone to see, and I've got a condition that you're not quite sure of, then you would use Vula to connect to the nearest specialist, and typically you'd get a response within 15 minutes. And essentially you are now giving me specialist healthcare in my local clinic. So it really takes specialist healthcare down to clinics that are very far away from specialist centers. So for example, in Northern Cape, Maphamp is about 7.5 hours drive to Kimberley, which is the nearest specialist. And we've now brought specialist care virtually to Maphamp, for example.
And when it comes to how many healthcare workers in South Africa and other countries who are making use of this app, how many have been able to, or how many patients were able to benefit from this app?
Yeah, so we started quite slowly. I think in the first year we only had about 300 patients, and we've just reached a total of 2.5 million patients in South Africa, which is about 1 in every 30 South Africans.
All right, Dr. William, thank you so much for your time this evening here in SABC News. That's Dr. William Mapham. He is the developer there for the Vula Emehlo Eye Clinic app. And of course, it does help those particularly in rural communities.